We can all picture the TV show scene of a patient being rushed into a trauma room and a surgeon ordering 6 units of blood. And while everyone needs blood to keep their vital organs functioning, many excellent research studies have shown that the practice of giving patients blood is based more on tradition than science. Not only that, it's a costly tradition. To learn more, watch and subscribe to Healthy Dialogues. Because blood is an immunosuppressant, it can cause a whole host of problems, including infections, increased ICU time, cancer recurrence, and in some cases, death. The risk of those bad outcomes increases with every unit of blood a patient receives. The question is always, how much blood is just enough to sustain life and recovery versus cause harm? At Intermountain Healthcare, we set out on a journey to look at these blood utilization studies and find out for ourselves what is best for our patients. We started by looking at patients' hematocrits before and after being given units of blood. In many cases, giving the patient's blood was not actually helpful, so the risk was just not worth it. After we learned that reducing blood use would improve patients' outcomes, we thought we'd look at the cost savings for patients and systems. The breakdown is quite interesting. The cost of a unit of blood from the American Red Cross is about $200 in our system. Then, the processing to make sure that a unit of blood matches perfectly for a patient increases cost to around $400. Because blood is a risky drug that can cause complications that need to be treated, the true cost to a hospital is closer to $1,200. We then charge the patient about $1,000 for each unit of blood, but after insurance payments, the hospital only gets about $200 if we get paid at all. Bottom line, blood is an expensive and very dangerous drug. Armed with the clinical evidence and cost data, we then set out to educate our physicians and create positive changes in practice patterns. No small task. Surprisingly, it was quite easy. We started sending regular reports to physicians showing them their own blood utilization and how it compared to the evidence-based guidelines. We simply shared this data. And what happened was an amazing change in blood utilization and outcomes. Since rolling out this program, we've seen a reduction of over 10,000 blood transfusions per year, and our hospital-acquired infection rate has decreased by 1/3. Reducing blood transfusions is not the only reason for these improved outcomes, but eliminating unnecessary blood transfusions is a big part of it. Along with that, our system is saving millions every year, savings which help our patients' bills and our sustainability. This is just one more example of how Intermountain works to provide high-quality care at an affordable cost.